Good afternoon, everyone. I'm Becky Widish, Chairman of the Niagara County Legislature. Thank you for joining us today live on LCTV for our daily Niagara County COVID-19 update. We're also currently streaming live on lctv.net, the county Facebook page, and we're on 90.9 FM on your radio. Today I'm joined by County Manager Rick Updegrove, who is going to give us some updates on county function at this time. But first, for the second time this week, unfortunately, I bring you very sad news. The county has confirmed 3 more COVID-19 related deaths as of today, which brings us to a total of 4 so far. The new announcements of the deceased include a 69-year-old male with underlying health conditions, a 90-year-old female with underlying health conditions, and an 82-year-old female with no underlying health conditions. We certainly offer our deepest condolences and prayers to the families and loved ones of these individuals. As a community, we certainly share your loss. Overall, for Niagara County, we have 11 new positive cases to report today. That brings us to a total of 166 positive cases of COVID-19 to date in Niagara County. 100 positive individuals are currently in isolation. 81 of those are isolating at home, with another 19 in hospital isolation. We have 62 individuals who have recovered. That's the good news. But again, 4 deaths so far in Niagara County from COVID-19. We also have 156 people currently in quarantine and another 158 who've completed quarantine. Again, we see that as good news. Those individuals did not have symptoms. They were quarantining out of an abundance of caution, and they have now passed that period that they need to be in quarantine and are able to move about a little bit again at this time. Our Niagara County heat map has again been updated with our daily totals. The map breaks down the positive cases of COVID-19 in Niagara County by municipality. You can see those totals on the screen now. You can also find the link to that map on the niagaracounty.com page. At the top of the page, there's a COVID-19 banner. You'll find the link for that heat map there. And that map is updated by noon on weekdays as we receive official confirmation through the State Department of Health of our daily numbers. Yesterday, we also gave you the link for the state's new COVID-19 map. That breaks down information and data for the entire state, county by county. You can click on different pieces of that map to see the different information that you're looking for. Again, we've placed a link to that state map on niagaracounty.com, again, in that banner at the top of the page for COVID-19 information. Staying on the state news today from the governor, he did announce today that we had another highest day yet for death rate across New York State with another 799 individuals. For a little bit of perspective, the governor reminded us that on 9/11, the deaths at the World Trade Center totaled 2,753. So far in New York State, COVID-19 has claimed the lives of 7,067 New Yorkers in these past few weeks. And that really gives you an idea of how hard hit we are by this virus. He also told us today that hospital admissions and ICU cases continue to significantly drop, which is the good news. That death rate lags behind and is higher, of course, because those individuals, again, have been in the hospital probably for a bit of time now on ventilators long term, and the longer they're on, the less likely they are to come off. So we will see those continued rising death rates, unfortunately, even with new hospitalizations dropping off. The governor again believes that this is a sign that we are starting to flatten that curve and possibly plateau in the situation statewide, especially downstate where they're hardest hit right now. But reminds us that even with this good news, what we can take from that is what we're doing does seem to be working. New York State on pause is still in effect. You still need to follow all of those guidelines of staying at home, keeping yourself and your family safe, but it does seem like we are seeing positive effects from those efforts. So please, again, continue to follow those guidelines and do your part in this situation. Now, as I said, County Manager Rick Updegrove is with us today to talk a little bit about county government. Now, Rick, we know that during this time, County Health Director Dan Stapleton is certainly focusing all his efforts on the public health component of COVID-19. But you, on the other hand, have been able to focus on the basic county functions that still need to be happening during this time in government. We're looking forward to, seeing how these developments play out over time. We all know that it's never too soon to start looking forward into what our community, our businesses, our government will look like once this crisis has passed. And I know you and your team are already working on those situations and how we can move forward and rebuild afterwards. Can you start maybe by telling us a little bit about the challenges that you faced this last month?
Well, let me start by saying that our priority has always been to protect the safety and security of Niagara County residents. And we have given a lot of authority and deference to those department heads that have the expertise that we are relying on to help us navigate this crisis. And as you mentioned, Dan Stapleton directly, emergency management, our sheriff, our public health director. Obviously, we've given them and we rely on their expertise to tackle this crisis. We have comprehensive plans in place for these types of for this type of crisis, including our COOP plan, which is our continuity of operations plan. And I want to thank all of our department heads for really stepping up and doing more than we could have even expected relative to addressing this crisis. This is something that is new to everybody, but I'm confident that we have the people in place that we need. As far as management of the day-to-day operations, which is really what I've had the ability to focus on, as other people handle those areas of the crisis that are within their expertise. And I think the biggest challenge that we've been confronted with is balancing social distancing and the executive orders that mandate staffing reductions against providing essential services. Most of the services that county government provides are essential. And as you know, Executive Order 202.4 mandated a 50% reduction in non-essential staff, meaning they can work from home or take leave without accruals. But we have essential services that we need to continue to provide, which we are doing. And I think that's challenge number one. In addition to the executive order that reduces staffing, we also have a state and a couple federal programs that have been implemented within the last few weeks. The New York State Paid Emergency Paid Sick Leave Law, the Federal Emergency FMLA Expansion Act, and the Federal Emergency Paid Sick Leave Act, all of which obviously pose challenges, but those laws were implemented for a reason, and we certainly appreciate that we have employees that will fit under some of these categories and are in a situation where they have to take advantage of these, and we will work with the staff that we have to make sure that we continue to meet those essential services. We have daily calls with our department heads, and one of the charges to the department heads is to continue to update your plan, your day-to-day plan, on how it is you are going to provide these services that are mandated to be provided and that our taxpayers expect. And there's been a couple little bumps in the road, but I've got to tell you that I'm certainly proud of our department heads, and I think given the challenges that they've been confronted with, I think they're doing a great job because for the sake of example, our treasurer's office is now open full-time. Our county clerk has done a really great job of balancing social distancing with the public's need to have access to his departments. He's implemented some very innovative ideas, such as scheduling, for the sake of example, scheduling the title examiners and the abstract examiners on a schedule which will limit the number of people that are in the clerk's office at any one point in time. We have also, our Buildings and Grounds Department has stepped up, and they have put screens where screens are appropriate. They have implemented an enhanced cleaning schedule, which is very important to the safety of not only the public, but to our employees. So, I just wanted to recognize them because, sometimes we don't always think about those challenges that maybe aren't quite as obvious, but they've been doing a great job. One of the other challenges that we've had, and I shouldn't really call it a challenge because I think we've tackled it, and that is the dissemination of information. It's always been a priority of county government that we try to provide as much information as possible relative to resources available, the operations of government, the policies that are being set by the government, and it's always been important. But I think that the importance of the dissemination of information, given this crisis, is taken on a whole new level, because we appreciate that people are scared that this is something that brings a whole lot of uncertainty into our lives, and I think that providing information regarding the virus, regarding the resources that are available to them, those are things that I think help calm people that are feeling that uncertainty.
Yes, I think, I don't mean to interrupt, but I think information is empowering. Whether it's good news or bad news, people want to hear that, right? Mm-hmm. They want to know the details, and we've had a great partnership with LCTV, so thank you for that recognition.
Well, and I wanted to thank you directly and personally, because I want to thank you for really taking the lead in this, because it's allowed me to focus on the day-to-day operations and the staffing challenges that we've had to provide those services. I mean, a lot of people, we don't always appreciate what those services include. Social services. I mean, we have people in social services that have to meet with the public who are in need, that need assistance or need health insurance or any of those myriad of benefits that right now have taken on a whole new level of importance, given what's going on with the economy and with the state. So those are people that are essential, and they're reporting to work, and we don't always think about that. But the information that's been provided in conjunction with yourself, with our public information office, I'm more than pleased. I'm proud of what we've been doing and what you've been doing. So thank you.
Thank you. Any lessons that you think we've learned throughout this last month or so and how we operate?
Well, I think, and this is the lesson that I've learned, and I think this is great news, is that this event has confirmed that we have the right infrastructure in place to deal with a crisis of this nature, and just as importantly, we have a resilient workforce that appreciates the mission of public service. And I think that when confronted with a challenge like this, I think people have the ability to rise up and to lead. And we've seen that. And, I don't want to, I'm pleased. I'm certainly not going to say I'm surprised. I was confident that that we are handling it the way that we knew we could handle it. So, and I would love to mention every department head. I mentioned a couple of our departments that really have been on the front lines of this, and obviously emergency management and public health come to mind, but every single department has been faced with challenges, from providing social services to the clerk's office, to the treasurer, to mental health, which really has been challenged with people that now are dealing with something that they hadn't dealt with a month ago. So thank you to our department heads. Thank you to our employees. That's the lesson.
Yeah, I couldn't agree with you more. I've said every day how proud I am of our team in Niagara County and the way that everyone has truly stepped up through this crisis and taken on those roles and just, diving in with new ideas, creative ideas. We've got some departments who are dealing with having to come in and be essential and be on the front lines, even though there is that risk, and they're willing to do so. Other departments who are completely shut down, everyone's home, and they're trying to balance, how do we still work? How do we still maintain that day-to-day government function, but now we're at home and having to deal with IT and not seeing each other. So yes, you hit it right on the head there with, just the pride that I think we have right now for our staff here in Niagara County.
That's a fair assessment.
Yeah. So certainly a big one here. We know, again, as we're looking forward into what this will look like for us when we come out the other side. And we will. We don't know exactly when or what that looks like yet. But the budget is always a year-round process to begin with. But I'm certain that this year the budget process for us will be very different. Do you have some comments to offer on the budget process and how that could go?
Well, yes, I do. Obviously, we're going to have some significant challenges. Challenges unlike anything I've seen during my tenure, and I don't mean as county manager, but going back to 2004 when I was first elected as a legislator. First and foremost, sales tax comprises sales tax comprises a large part of our budget. It's almost as much revenue to the county as the property tax levy. It's about $70 million. We expect there to be a reduction in sales tax. Although we monitor our sales tax numbers on a month-to-month basis, I think we're a couple months out from really knowing what the impact is going to be. But just for the sake of example, and this isn't written in stone, and just as an example, we're collecting about $70 million. Our tax cap is going to be less than $1.6 million. Well, even a 10% change in sales tax, the impact would be significant, even 10%. And so I'm not suggesting it's going to be 10%, could be more, could be less. But what I expect there to possibly be a little bit of a bump in March, because I know there was a lot of spending going on as we approached, as we approached the shutdown. But the businesses that provide the most or the largest portion of sales tax are automobile sales, fuel sales, and retail. The big box retailers. And obviously they're going to be impacted. And they provide the largest portion of the county sales tax revenue. And in addition to that, with the Canadian border being closed, that's going to have an impact on retail sales. So we expect there to be that reduction. And we'll have an idea soon as to where we're headed. But the other challenge that we're facing is the executive budget that was recently passed. There's a couple pieces of that budget that are concerning. First and foremost, and I'm reading right from the enacted state budget county impact summary from the New York State Association of Counties. The state fiscal year 21 enacted budget allows the budget director to adjust all appropriations, including capital and operating aid, based on whether the financial plan is out of balance by more than 1% during any measurement period. If the threshold is breached, the executive will have authority to make spending cuts as necessary to bring the financial plan back into balance. Now, as a layperson, before I became involved in the government, when I heard spending cut, that wouldn't mean a lot to me other than, the state's cutting spending. That's a good thing. But what those of us in government have learned is that when the state cuts spending, that is aid that goes to the counties to provide the mandated programs that are in place as a result of the mandates from state government. And so typically what state spending means is that more of those costs will be pushed on to the property taxpayer at the county level. And that's disconcerting. In addition to that, a couple other pieces from the executive budget that we're following up on, that we're concerned about. 730 restoration money. 730 restoration money is the monies that we pay to house and treat individuals who are charged with felonies, who are not competent to stand trial. Historically, the split on those costs has been 50-50, state and county. This budget shifts 100% of the cost to the county. Well, we spent almost $700,000 last year, so the math is pretty easy. If we have a year this year like we had last year, it's going to cost us another $700,000. And as I mentioned earlier, our tax cap is going to be less than $1.6 million. And it's going to be less because it's 2% or the rate of inflation. The rate of inflation we expect this year to be less than 2%. So we don't know what our cap is right now, but we know it's going to be less than 1.6 million. And I point that out because I just want to put this in perspective. With those little changes, a change to 730 restoration money, how it can impact the county budget. It has a significant impact on us. Also, pension costs. Well, we expect them to rise because if the stock market continues the path that it's been on over the last several weeks, will obviously be required to increase those contributions. And one of the other things that was contained in that budget, as many of you know, the state has set up a distressed hospital fund, and so the fund, the distressed hospital fund, is going to be funded with county tax dollars, and so the state is going to intercept $760,000 of county sales tax money to help fund this distressed hospital fund. Now, I certainly don't want to seem as though I don't appreciate the objective. I absolutely agree. I understand. If one thing we've learned from this is that those hospitals that were forced to close several years ago suddenly seem very important. And I'm sure that there's a lot of people that were, policymakers or decision makers relative or at or about that time that are probably taking another look at some of those decisions that were made. So I absolutely support the idea of funding and helping distressed hospitals, as do all the other policymakers in Niagara County and every legislator that I've talked to. But the issue really is where does the source of revenues come from? Because we obviously have some significant challenges. We're trying to do everything we can to mitigate the effect on the property taxpayers. And so every dollar to us counts. And we have to watch those revenues, and anything that impacts them is going to pose another challenge. But the good news, and there is good news. So since 2012, and that's the inception of the passage of the property tax cap, the Niagara County, and this is kudos to the Niagara County Legislature, Niagara County has never exceeded the tax cap. So I'm not going to sit here today and say that I'm not prepared to come under the cap, but it's going to be challenging, okay? But the other good news is that through the policies of the legislature, and we have built and maintained a very a strong fund balance. We've maintained the type of fund balance that has led to increases in our bond rating year over year. And right now we have a superior bond rating. So the good news is superior bond rating, robust fund balance, and a history of reducing the property tax rate and coming under the cap. So we're going to continue. I mean, our mission has not changed. Our policy has not changed. We will do what we need to do moving forward. And there's also some other opportunities. I just wanted to mention them real quick. One of the things that we are doing is that we are recording all COVID-related expenses. Mm-hmm. Very important. And the reason that's important is because if there is reimbursement down the road through FEMA, for the state and federal government, we want to make sure that we are in a position to account for every single dollar. And the other thing is we also believe that there will be another round of federal stimulus monies. Now, I almost left out one part of the good news. So the good news is that the executive budget does not remove the cap on Medicaid, nor does it intercept FMAP monies, which are the Medicaid assistance percentage money. We are very concerned about that. So I want to thank the governor for that. Also, Senator Schumer has obtained additional FMAP monies for the local governments. That will be a big help to us, but we do expect other federal stimulus monies to come our way. We're optimistic. That will go a long way into helping us meet these budget challenges, and we will continue to monitor it. But I want to remain, although we have some challenges, I remain optimistic. Okay?
Agreed. Well said.
Thank you.
I think, Rick, of course, you and I in our roles pay much closer attention to the state budget as it's being worked on and rolled out than the general public would. That's part of our job, of course, is to do that and to know how it will affect us in the county level. But what I can say is I think the takeaway for the public to understand at this point, the big point in my opinion, is to understand that we already were seeing some challenges headed our way in the state budget process. Things like the 730 mental health competency, added expenses that were coming our way. But now on top of those challenges, layer on COVID-19, which has rewritten the book. It truly is. There is no playbook for this. It's unprecedented. But I also have heard you on our daily department head conference calls. We're both on those, and I've heard you again and again already start talking to those department heads about the budget process. I mean, we're only in April, and we're already talking about, taking a look at maybe some different ideas and ways that we can help address those situations in the budget, and we'll of course monitor all of those relief programs and everything that come in along the way. So thank you, because that was a very comprehensive explanation for our residents as to how some of this is going to affect us long-term financially. So I certainly appreciate you being here with us today. Tough decisions to come, just as every family and business in Niagara County will be dealing with those at the government level as well. So thank you. Yesterday we talked about the new social media campaign that the governor has put out, talking about everyone's individual responsibility in staying home and following the physical distancing guidelines. And I told everyone that I'm staying home for all of the Niagara County first responders who have to be out each and every day, putting themselves at risk, even more so now during this time. Rick, who do you stay home for?
Well, both of my sisters-in-law are in the medical field. In the nursing profession. I appreciate more than ever what they do. So I'll remember when I leave here today to call them and thank them again.
That's wonderful.
So that's
wonderful. Thank you.
Thank you, Becky.
Of course, thank you to all of those first responders and healthcare workers that are out there working hard for us. And we pledge to do our part to help keep those surges out of the hospitals, to stay home and to keep everybody healthy. I do want to pass along some positive news, if you will, coming out of the county. We hear again and again of the extraordinary ways that residents are stepping up to help their communities. And I just want to give a little bit of acknowledgement to one of our legislators, Jesse Gooch, who is in the Wheatfield and North Tonawanda area that he represents. I've been seeing that weekly he's doing senior meals. He's organizing through a food truck and holding them at the Wheatfield Town Hall parking lot, where he's able to get meals for seniors at a very reduced cost to help out with some of their needs at this time. I also was just told right before we went on live today that yesterday he provided pizza to the entire staff of the public health and mental health departments in Lockport, and did the same again today for the Niagara Falls staff. So Legislator Gooch, thank you very much for everything that you're doing. I'm hearing more and more stories about the ways that you're helping your residents to get the meals that they need at this time. So thank you for really stepping up. Many of our legislators are doing that. We're working from home as well at this time, and trying to focus on our individual districts and the needs there in the community. So thank you to all of them that are helping out. Again, we mentioned today that everyone is, of course, struggling right now in their own ways. Some individuals are dealing with the stress of having to be out in the public and working as an essential employee. Some are dealing with the added anxiety and worry of finances, or being home and, in close quarters with big families, which can be stressful. Many different reasons that someone might be experiencing, some issues right now that really they're just having a hard time handling the situation and the uncertainty that's involved. So again, we remind you that if you call 285-3515, that is our crisis services lines for mental health in Niagara County. It is available 24/7, free and confidential. There are individuals there that are willing to talk to you and help you get the support that you need at this difficult time. So again, that number is 285-3515, and we encourage you to reach out if you are in need. If you joined us late today, you can catch the broadcast again several times during the evening. LCTV has been kind enough to add us to their schedule and replay as it allows during the evening. There will also be a link on the on-demand page of lctv.net under the Niagara County Legislature button. You can go on our Niagara County Facebook page to watch the recording again if you'd like, and we share that on all of our social media as well. So we thank LCTV again for the partnership, for all of the other news stations and media outlets that have chosen to pick up our live feed or use our clips later to help with their broadcasts. Thank you for joining us. With the holiday weekend coming up, we certainly ask you, of course, to again, make sure that you're following those gathering guidelines. There shouldn't be big family dinners at this time or parties. We know that it's hard to be with just your immediate family at this time, especially when you add in the religious element of the weekend. People want to be with their church communities and their larger groups of friends and family. But again, very important to follow those guidelines at this time and keep yourself at home. Look online. I know there are many churches that are holding online services that you can join and watch, and just reach out to the friends and family by phone. A lot of families are doing virtual Easter dinner and things like that as they can. So please, with Good Friday tomorrow, just keep those in mind, and we will be back with you for our next update. You can watch on our websites for updates on when we'll see you again live. We know that with the staff out of the office for the weekend that our map will not be updated, so you can check that state map as well. And when we do receive updates through the Department of State Health Department, we will update those when we have them available. So for now, everyone, please stay home, stay safe, and stay healthy.